7:42. Everyone.
You look great.
Thank you. I work on it. Is looking for younger skin. Dr. Richard Chaffoo is here to tell us the answer. Maybe in beauty creams, may not be, maybe or may not be, or in your snacks. Help me, doctor. I'm so worried about the wrinkles on my face.
We're all worried about that, Shally. You know, as you know, collagen is the most common protein that we have. It's in our skin, our hair, nails, and bone. At about the age of 25, we begin to lose collagen. And by the age of 50, half of that collagen has been lost.
I've been learning a lot about this because I'm in that like zone right now. The collagen, I've heard of it, that you rub it on your face.
Yes.
But people are eating it now.
They are, and you know there's been a big push. A lot of these products were originally in Europe and Asia, and they're now making their way into the US. And so the idea was, well gosh, can we take supplements or products or foods even that are going to, you know, restore our collagen? And the truth of the matter is that unfortunately, it's not that simple. A lot of these products that are being touted, I think it's important for the public to know, are not really regulated by the FDA. So some of the claims that, you know, some of these protein shakes or some things that you can eat are going to restore collagen.
I use some of that collagen, like powder stuff.
Right.
Wait, so it's not doing anything?
It's probably not doing anything. And the reason is, you know, I talked to my wife, Susan Stewart, who's a dermatologist, and I asked her about this. And the problem is that when we ingest collagen, it gets into our gut, into our stomach, it's broken down into the basic amino acids. And we can use those, of course, in building. But collagen itself is a very complex, tightly woven protein.
Okay.
And unfortunately, there's no way we can ingest it and maintain that to where it's going to magically get transported into the skin.
But they say you are what you eat, right? So there are certain foods that you can eat that might help?
Yes, absolutely. So there are certain types of foods that, you know, that we can eat. You know, one of the things that we forget about is the importance of vitamins. Vitamins are crucial in terms of protein collagen synthesis. Things like, for example, the red bell pepper. Eating half of one of those a day gives you 158% of your vitamin C requirements, which is a very important protein. Tomatoes are a great source of what's called lycopene, which is one of the antioxidants responsible for maintaining our collagen so we don't break it down. Sweet potatoes, vitamin A, a great source for protein synthesis.
We've got to come back one time. I think I read a study how vitamin deficient Americans are. Like, so many of us don't even realize. So we got to do like a whole thing on that.
I think that'd be a good topic.
In the meantime, let's talk a little bit about some other news, because I saw this pop yesterday, and this was pretty interesting to me.
Yes.
Pregnant women smoking weed while pregnant to get rid of morning sickness. What?
Right. Well, the problem was that they did a research study, Shally, and the two researchers phone called about 400 of these cannabis dispensaries throughout Colorado, and they found, unfortunately, that the majority of these clinics were recommending to these researchers who posed as women in their first trimester of pregnancy, being very, nauseated and having a lot of vomiting, recommended the use of cannabis. And unfortunately, it was based upon their personal recommendations, not based upon science.
So this isn't, somebody hearing this right now, this is not something that is like approved to go do.
No, absolutely not. I think it's important for the public to understand that this is a Schedule I drug. Even though it's legalized in certain areas, we need to understand that there are some studies that have definitively shown, Shally, that women that use cannabis during pregnancy have a higher risk of their babies ending up in a neonatal intensive care unit. There's definitive evidence in adults and certainly in children that repeated use of cannabis can cause neurological damage that's permanent. We know in adults that are regular users of cannabis, there is a permanent effect that occurs in the frontal lobe. There are PET scans that have been done and looked at the flow or function of the frontal lobe, which is responsible for judgment and executive function. It's diminished in those subjects. So certainly there is a potential risk for the unborn child.
It's just not worth taking with the little babies growing in your belly. Dr. Chaffoo, thank you.
Good to see you.
Good to see you. All right, it is